values. We begin today with a virtual address by Padma Shri Sethuraman Panchanathan, a global expert in technology and innovation. Born in Chennai, Padma Shri Sethuraman Panchanathan is an Indian-American computer scientist and academic administrator. He currently serves as the Foundation Chair of Computing and Informatics in the School of Computing and Augmented Intelligence at Arizona State University. From 2019 to 2025, Dr. Panchanathan served as the Director of the United States National Science Foundation, after which he returned to Arizona State University as Professor for Technology and Innovation. Throughout his illustrious career, he has worked towards strengthening educational and research partnerships between the United States and India, believing firmly that science, technology, and innovation partnerships are the backbone of future success. A prolific inventor, Dr. Panchanathan holds several patents and copyrights and has published nearly 500 papers in prestigious journals and conferences worldwide. A long-standing devotee of Bhagwan, Dr. Panchanathan maintains a deep connection with the Sai movement. In 2021, the Sri Sathya Sai Institute of Higher Learning conferred upon him an honorary doctorate of science in recognition of his outstanding contributions in computer science and engineering in the service of society. In 2024, he delivered the convocation address at Sri Sathya Sai Institute of Higher Learning, inspiring many young minds. Most recently, in May 2025, he was conferred the prestigious Padma Shri Award by the Government of India for his distinguished contributions to science and technology. Today, he will share his insights on how the intersection of healthcare and innovation can shape the future of care models, making them more accessible, impactful, and compassionate. Please join me in welcoming Padma Shri Sethuraman Panchanathan.
Sai Ram to all of you. Thank you so much for that very kind introduction. I will say that it is all, I surrender it all at Swami's Divine Lotus Feet. My humble pranams at the Divine Lotus Feet. It's truly a delight to participate in this global conference on Sri Sathya Sai Ideal Healthcare. I am very grateful to dear brother Dr. Sundaresh for the kind invitation. The dictum of the super specialty hospital is Paropakarartham idam shariram. The body is a gift given for the service of humanity. I want to take this moment, a few moments, to highlight three elements in my talk. First is strategy, second is advancement, and third is innovation or impact. Sai, strategy, advancement, and innovation. Let's start with strategy. Here I would like to share a few precious moments from one of the interactions with our beloved Bhagwan. In summer 2001, Swami inspired me to bring a group of young adults from Arizona. And we came in December 2001 to Panchanathan. He blessed us with a wonderful interview. He specifically talked about the Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield Hospital, in that interview amongst other things that was recently built at that time. He asked, in fact, one of the young adults to bring the architectural rendition of the hospital from the inner room and talked about the various features of the hospital in great detail and shared that with the youth. As he was doing that, you could see him beaming with pride and at the same time filled with compassion and care, all of which were in full measure. He discussed the work of his mission in terms of the three H's. The head, he said, the university; heart, the hospital; and hands, the water project, as illustrations. He commented on the work that will be done in the hospital to benefit all people, and Sister Dr. Geeta's presentation preceding this is a clear testimony to that. He described the primary focus of the hospital providing high quality and free health care. It was an amazing conversation and a lesson for all of us on how grand projects are realized through a perfect convergence of strategy, tactics, and operations, all working together in a unified manner. We all know Swami is a visionary par excellence. He strategically placed the Sathya Sai Institute of Higher Medical Sciences and the Sathya Sai Institute of Higher Learning next to each other. This is a brilliant concept. People did not realize this. They thought it happened to be, say, in the same location, both in Whitefield and Panchanathan. Actually, if you start to look at what people are doing now at the Indian Institute of Science or some of the IITs, is realizing the importance of how do you bring healthcare institutions, clinical settings, along with the research that happens in academic institutions. This is a very, very, very important concept that requires to be done in order to foster innovation, in order to rapidly translate fundamental discoveries to applied translations to benefit clinical care. And this is something Swami had already done, and you see most of the established institutions in the United States and worldwide all have the clinical components in the hospitals in the campus or adjacent to campus, just like what we have in Panchanathan as well as in Whitefield. Why is it so important? Ideas and talent exchanges happen organically due to the adjacency. We talked about this not only for the medical and clinical settings, such proximity, but also expanded to the thinking about rural settings and urban settings, all being incorporated through the Sathya Sai institutions. And we talked about this in IT for Sai conference, the Societal Advancement and Integration Conference, of how it can help rural education, healthcare, other kinds of projects that can be unveiled because of this tremendous synergy and symbiosis. We all know, therefore, that he is the exemplar strategist and therefore a huge inspiration for all of us. And for me, a tremendous inspiration for all the things that we embark in right here in the United States and with global impact. So strategy, advancement. This is a unique moment of how the power of science, technology, and innovation is advancing and transforming healthcare. The focus on better health outcomes and wellness is not just about managing and curing illnesses, as important as it may be, but it is also about how do you ensure that you are also focused on wellness, proactively thinking about how to ensure people have good health, and at the same time providing the highest quality care when people get sick or ill. We all witnessed how a global pandemic, which challenged all of us, brought us together across nations working together to unleash rapid solutions by harnessing the immense power and potential of science, technology, innovation, as well as global collaborations. Nations coming together, sharing data, sharing best practices, sharing what works, so that all parts of the globe can benefit from delivering the best quality healthcare and therefore achieving best healthcare outcomes. For example, at NSF, we had a variety of projects that led to the moment being seized to deliver the outcomes. For example, in the 1960s, NSF funded a project for understanding a bacterium in the Yellowstone National Park. And that actually led to the development of PCR testing, which was used extensively during COVID. Likewise, advancements in advanced manufacturing that was initiated and incubated in the 1970s by NSF investments led to the birth of the 3D printing technologies, which was again extensively used for producing the PPEs. Likewise, investments in people like the Nobel laureate Jennifer Doudna, who invented the CRISPR technology and in the RNA and mRNA work met the COVID moment. There are thousands and thousands of examples like this. This is why this proximity of the clinical and healthcare environment with an outstanding research university is exceedingly important. And the investment that is made by the federal government and others, industry and others, essentially contribute to advancing innovations at scale and at speed. For example, in the context of healthcare, global healthcare, the convergence of biomedicine, systems biology, synthetic biology, genomics, biochemistry, biophysics, you can go on and on and on, genomics, proteomics, all omics in general, informatics, engineering, devices, technologies, social and behavioral sciences, humanities, policy, law, regulations, economics, and most importantly, spirituality, is how we find comprehensive solutions to the cycle of wellness to illness and back to wellness. Going from pre-symptomatic to diagnostic to therapeutic. How do we ensure we provide the highest quality care? Advanced technologies such as big data, machine learning, AI, nanotech, quantum, biomaterials, advanced manufacturing, advanced wireless, biotech, and more are indeed transforming healthcare monitoring and healthcare delivery. I know that all of you will feel not fulfilled if we don't talk about AI. These days, no talk will be complete without AI, my own research area. AI of today is a result of sustained investments over the last 5 to 6 decades by NSF, primarily in the United States, and of course by other agencies, industry all across the globe. Even during the AI winters, when people walked away with skepticism from AI, NSF hyper-invested. This is an important point to note. Federal investments and other investments, which are not necessarily looking only for immediate benefits, but sustained investments and tolerating failures, several failures before successes, and not even focused on a specific outcome, are the kind of things that ensures that fundamental technologies are unleashed as time progresses on. I always remind people, it's not only what NSF and other agencies do, and in India, the Anustan's National Research Foundation and other agencies in India, when they invest, it's not about what we are advancing the technologies of today, as important as they are, like AI, quantum, biotech, and others. But what we are really doing is seeding those technologies for which we don't even have names today. Those names will probably appear in a decade or 2 decades or 3 decades from now. And that's the kind of environment you want to create, sustain. And I'm pleased to see that that kind of work is happening already. And I'll come back and talk about that. Back to AI. We know that this takes us to this segment on impact. And I want to take an example in the impact context about AI. We can talk about every aspect of healthcare being impacted by AI and other technologies too. We can spend essentially a week talking about all of this and still it will not be sufficient. Many of which you already know because you're working with technologies right now in the hospital, as well as working with those technologies and building the future technologies and discoveries in the university and the institute. Let's talk about AI and radiology, because this is something that I know some of the folks working in both Puttaparthi and Whitefield, and in fact sharing your expertise between the two campuses, is something that is in full vogue at Panchanathan and Whitefield. I want to quote a recent New York Times article, which was about a month ago, that came about, which delved into this topic. In that article, there was a talk about the various facets of how the initial feelings about what radiology would become with AI coming into the fore, by even Nobel laureates like Jeff Hinton, for example. 9 years back, the 2024 Nobel laureate Jeff Hinton, I had the good fortune of attending the Nobel Prize ceremony in Stockholm last December and celebrating his Nobel Prize winning unbelievable career and discoveries. Jeff Hinton predicted that we may want to stop training radiologists. 9 years ago, he said that in 5 years, we may want to stop training radiologists because AI will likely outperform them. However, we know that that's not the case. We see that this is not necessarily true. And Nobel laureate Hinton subsequently credited himself, said that now I should have not made it as broad as it is, but it is much more about what the tools can augment the radiologists and experts to be able to do this, in a much more sophisticated way. AI is a powerful tool and has the potential to enhance human abilities. Typically, AI is used in the case of radiology to enhance images, automate routine tasks, identify clinical abnormalities, and predict diseases. For example, a research project in radiology at the Mayo Clinic employs AI to detect small changes in shape and texture of the pancreas to identify cancer well ahead of conventional diagnosis. AI also has the potential to serve as a second set of eyes. Particularly, radiology and cardiology are leading the pack in terms of the use of AI in healthcare, both of which are in full force in SSI HMS. The US Food and Drug Administration, FDA, has approved the use of over 1,000 AI applications. The Mayo Clinic is using more than 250 AI models for advancing healthcare. The gloomy predictions that AI will displace people underestimate the complexity of the work done by humans. In this context, radiologists do a lot more than just reading scans, and we all know that. In some cases, new technologies open the door to insights that are beyond the human ability. In other words, math can sometimes see what the human eye cannot. And the human-machine symbiosis is about enhancing efficiency, accuracy, economy, speed, scale, and access. However, the best outcomes are achieved when the solutions are designed with a focus on humanity, with an emphasis on human values, ethics, and responsible innovation. And this is something that is coming to the forefront these days. Technology should never be about technology in the forefront. It's about the humanity. It's about how technology comes to serve humanity, learn from the interactions with humans, and see how it can serve even better. This is what I mean by the symbiosis and the synergistic way. I call it the co-evolution of humans and machines, co-evolving together so that both of them can do better to serve humanity. I'm very delighted to see the convergence evolving in Prasanth Layman Whitefield. I was excited to learn, in fact, as recent as last week, M. Subramaniam from the IT department of Sathya Sai Institute of Higher Medical Sciences graduated with his PhD from the Sri Sathya Sai Institute of Higher Learning with his research work done at the convergence of the two institutions. And I know that there are many such projects across disciplines that's happening between the hospital and the hospitals and the university. This is a tremendous opportunity for co-creation and co-evolution that is bound to have huge impact. And I'm so thrilled that you are all working on that with vigor, with excitement, with devotion, and I have no doubt that Swami will work through us to unleash the unbelievable technologies of the future and solutions of the future. I want to congratulate all of you for making this happen and wish you all the very best. I'm so thrilled that this conference is focusing on the technology piece in addition to the care piece, as well as bringing the two of that together. I'm also excited that this conference is bringing together academics, researchers, and clinical practitioners, all of them together, and leaders, all of them together, because that's the kind of symbiosis and synergy that is needed. Back to strategy, advancement, back to innovation, Sai is working through us. Therefore, it is for us now to allow Sai to strategize, advance, and create impact through all of us, that he may work through us at speed and at scale everywhere. I will conclude with quoting back the dictum. Paropakarartham idam shariram. The body is gifted for the service of humanity. Maybe it is time for us to say, Paropakarartham idam shariram tantrajnanam. That is, the body and technology are for the service of humanity. With that, I surrender again all of this to the divine lotus feet of my most beloved Lord, Bhagavan Sri Sathya Sai Baba, and thank him, and I have utmost gratitude for him using me as his instrument, and I pray that he uses me as his instrument in years to come. I surrender it all at his divine lotus feet. Jai Sai Ram.